Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today's show, we have Deborah Bradley. She's a medical oncologist and executive coach. We're going to talk about her Kevin MD article titled What It Means to Leave Clinical Medicine. Deborah, welcome to the show.
Thank you so much, Kevin. I really appreciate you having me on today.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Yes. So I have wanted to be a physician for as long as I can remember. Graduated from medical school over 20 years ago now, took the traditional path straight through residency, straight through fellowship in hematology oncology, was initially in academics, then decided to go to private practice. And I've spent the rest of my clinical career in a position which I say is somewhere in between. More recently, I have actually made the decision to leave clinical medicine. Monday the 10th was actually my last day, and I am starting the next chapter on the 17th, going into industry/pharma, and I'm really excited to see where this takes me.
Wonderful. And I think we're going to talk about this journey in your Kevin MD article titled What It Means to Leave Clinical Medicine. I'm certainly interested in hearing more about your own transition. But just for my audience who didn't get a chance to read your article, just walk my audience through it. Share the story why you decided to write it.
Yeah, I wrote actually two articles. My first was making the decision to stay, and then I followed it up with what it means to leave clinical medicine. And it is interesting because I feel like medicine is just in a really hard place right now. And I think many of us are saying, like, this isn't what we signed up for. What is happening today? How have we gotten here? And I came into clinic one day and I was like, I'm done. I'm done. I can't do this anymore. I'm not willing to do this anymore. And it was the strangest thing because it was like a switch flipped in my brain. And I just all of a sudden was like, I am done. And so in my first article, it was really me breaking that down and unpacking it and saying, what does this mean? Like, how did you get here? And me actually experiencing fear of, yeah, I know what I want to do. It's time for me to retire from clinical medicine. It's time for me to get on with the next chapter. But clinical medicine is all I know. And it's been what I've been doing for over 20 years. And so when my decision to leave was initially there, I was like, whoa, hold on, I can't do this, right? It was really fear speaking. And so when I wrote that article, I realized that in this journey, I was going through the stages of grief. And at that point in time, I was actually bargaining. And so my next article of what does it really mean to leave is when I shared my stages of grief in leaving something that I dreamed of and reached. And I was like, is this some kind of arrival fallacy? And I think that no, it's not an arrival fallacy. I was like, am I burned out? And I was definitely burned out about a year ago. I mean, I was like crispy bacon, unedible, the kind you just toss in the trash, right? There's no recovering or eating that bacon. But I've done a lot of things. I hired a physician coach. I've worked with physician groups. And I feel like I've really gotten into a really good place where I'm now a recovering people pleaser. I've learned to set some boundaries. I'm very happy in the rest of my life. So I was trying to figure out, like, why can I just not make myself happy here? And it was this realization that it's time to move on. It's time for me to do the things that really ignite my passion again. And it's like the music had stopped in medicine. And I think a lot of it is the moral injury that we're experiencing on a day-to-day basis. For me, that was a boundary. And it was, this is just not something that I want to do, that I'm willing to do. But it's such an important part of my life, my identity, that I had to go through the stages of grieving. And I spent a lot of time in denial. And even though I think I knew about a year ago, when I walked into the room of this very young patient that I identified too strongly with, I was like, wow, if this was me in a week, would I be happy? No, I'd have a lot of regrets. And I started to think, is this what I want to be doing? Do I want to be spending my days in Epic? Do I want to keep giving up my nights and my weekends and risking your life to drive to work on snowy days, icy days? What do I want to keep doing? And for me, it was like, I don't think I want to do that, but I really didn't see the other opportunities as available to me because, again, I was like, this is what I do. And with denial, it was like pushing this huge beach ball down into the
Mhm.
water, like over and over again. And it would just pop up. And for me, it was popping up as anxiety, depression. And it wasn't until I could get past the denial of, hey, you know what? This was your dream. Like, you're successful, you're doing well. I think I'm a good doctor. I'm taking good care of patients, but it's just not what I want to do anymore. And so I then went through anger of, you know what, the system's broken me, right? And I realized I was in this victim mentality, but I was like, I didn't sign up for this. Like, they have finally broken me. And bargaining again, when I wrote that article of, no, I can stay, I'm just going to stay on
Mhm.
my terms. And then finally getting to acceptance and really realizing that with acceptance, I had to really drop my people pleasing. I had to make decisions with uncertainty. And I really had to learn to walk with fear, right? Stepping into something that's brand new for me and that I'm not an expert on. And I think that just took time.
Sure.
And I think it's so important to take the time to really find yourself and figure out who you are if you reach that point. Because I feel like right now there's so many people that are unhappy and they want to flee.
Yeah.
And people could say, what are you doing? Right. But I think it's just so important to find yourself. And I feel like in medicine, we give so much that we can really lose ourselves.
So, in this time period where you were going through these stages and you were considering leaving clinical medicine, give us a time course of how long this process took.
It was a year. It
Yeah.
was really a year.
And was it the medicine itself, or was it just all the things surrounding medicine, whether it's the EMR or the bureaucracy or the obstacles? So, give us a sense of what exactly was leading to your moral injury.
Yeah, I think it was a little of both. For me, when I started, it was always were the people who could get it done, right? If something wasn't happening, if our patient needed it, I felt like I could always make it happen one way or another. And I realized at this point in time, sure, we were in the pandemic, there's all kinds of supply chain issues, but it got to the point that if I felt that the patient really needed something, if the insurance company says yes, then I guess I could do it. If there was IV contrast available, we could do it. And if I wanted to directly admit a patient, is there a bed? Is there enough nurses? I think I would have eventually made this decision, but I don't know, maybe a couple of years ago. Who knows, right?
Mhm.
You don't know. But I definitely think going through that moral injury on a day-to-day basis, almost like these micro traumas, right? Of like
Yeah.
people like poking you daily, I think really forced me, or I'm not going to say forced, but really got me to the point where I'm like, this is a boundary that I'm not willing to accept. But I think if I'm also realistic, I'm a medical oncologist. And although I am honored to have been a medical oncologist and to have played such a significant role in these patients for many years, I also realize that that is very draining, right? Like when you
Sure.
walk in and you tell someone they have a new diagnosis of pancreatic cancer, like you're changing the course of their lives, usually not for the better. And it takes a lot of energy to do that day in, day out. And so I think I also got to the point where it was just like, okay, I've been doing this for a long time and I don't have the passion to continue to do it. I'm tired. And I felt, you know what, the patients deserve more, right? They deserve better. And there was certainly some guilt of, wow, this is the great resignation. If I leave, I'm not withholding my moral obligation of continuing this journey with patients. But I also had to recognize like, I need to follow my heart. I need to follow what's important to me. And that if I don't have that passion, it's not fair to myself and it's not fair for the patients to continue to show up in that way.
So, after you made the decision to leave clinical medicine, give us a sense into your mindset in terms of how you decided to proceed as to your next career steps.
Yeah. For me, I have a lot of background in research. The beginning of my career was very academic. And so I'm very fortunate in that is something that I've enjoyed and had actually been thinking about probably for about 6 to 8 months of, I miss this. And so I was like, okay, I can go into the industry pharma arena and I can still be a medical oncologist. So I can still indirectly affect patient care, maybe even on a larger level. So for me, it was really a an easy decision. It wasn't like I needed to go find something that I could do, but there was this passion inside of me to go ahead and get back to those roots. And so I'm very fortunate that for me, the answer was obvious.
So we have a lot of physicians who listen to this show who write on Kevin MD, and I'm sure that you coach a lot of physicians who were in similar positions to what you were feeling. They're feeling moral injury every day, and they're feeling that there's just so many obstacles that's preventing them from giving the best care they possibly could to patients. Now, you took the next step and actually left clinical medicine, but what
Mhm.
about those other physicians who are in that gray area? They may be still in those stages that you were talking about. What's your advice to them in terms of how best to proceed going forward?
Yeah, I think the first one is to really take a look inside. Who are you and where's your North Star? What's really driving you? And I think also to recognize that as a physician, there's many other things that you should do. Now, I'm not advocating for people to leave clinical medicine. I very much, again, it's something I dreamed about and enjoyed and feel that it was an honor to be there. One of the things that I think is very important is for us to have an identity that's more than just a physician, right? You have to have other ways to charge up your battery. And I like to tell my clients, like, you got to show up at least on a high yellow, right? Because you are going to get drained nowadays. Ideally green. So what gets you to green? And so it's twofold. It's number one, really taking a look at yourself and getting rid of all the other, what will people think? Who will I be if I'm not a clinician? Is there anything else that I can do as an MD? Well, yeah, there's tons of stuff that you can do. And for me and for many that I talk to, like those aren't even possibilities that are available to them, right? Like we have a lot of skills that are transferable. But again, it's number one is make sure that you're not running away, right? That you're not leaving in desperation and you just get me out of here. Because I fear that, again, that's not going to fix it. I think it's really work with someone, take some time, journal, hire a coach, work with a mental health professional, but really find yourself. And I think when you can show up as your authentic self, then the rest falls in place.
So I think that's one of the prevailing themes that I also try to spread is that physicians are more than their degrees, right? You don't want to be defined as just being a physician who goes to the hospital or goes to the clinic and just see patients all the time. Now, that's of course easier said than done. So you mentioned that you recommended these physicians hire outside help to find who their authentic selves are. From your experience and when you do your own coaching, how difficult is it for those physicians to find who they are and find out identities other than being a clinical physician?
I think it's really hard at first, right? Like I think that me myself, I got there, but it took time, right? And
Yeah.
as physicians, we're very used to saying, "Oh, I can just Google it, or I can just do whatever I need. Like I can fix this," right? But I don't think we're very good at accepting that sometimes we need another view, right? That we need people to help us see our blind spots, that we need to just talk about what we're experiencing on a day to day basis because it's a lot. So it absolutely takes time because I feel like we're cultured, we're trained to be physicians, right? And to always be a physician and to always put our patients first, the hospital first, everything first. So it definitely takes work, but it is certainly possible. And I am so grateful that I'm now in the point where I show up empowered and I show up my authentic self. And I now recognize, you know what, not everyone's going to like me. And that when I'm thinking about, oh my gosh, what are they thinking? They're probably not even thinking about me at all. And looking at my own thoughts and just realizing like how much time a day I was wasting in these thought tornadoes that, again, these were things that I was creating in my mind. So, yeah, getting to the point where you're authentic self and you show up and you show up doing what makes you happy. I like to say, I'm now the CEO of my life and I show up the way that makes me happy in work, out of work. And that's really my goal for everyone is to, again, you are who you are. Don't try to hide it. Don't try to be what you think other people think you should be. Or I think the worst is what we think other people think we should be. I think so much of this is what we do to ourselves or these expectations we put on ourselves.
We're talking to Deborah Bradley. She's a medical oncologist and executive coach. Her Kevin MD article is titled What It Means to Leave Clinical Medicine. Deborah, if you were to relive your life to this point again, is there anything that you would have done differently?
Absolutely. I really wish that I would have hired a coach, even known what a coach was much earlier on. It's interesting in business, it's so common, but I would have hired someone to really just help me through. And I would have tried to get rid of people pleasing, and I would have tried to set boundaries and be comfortable showing up as my authentic self from the get go. I think that's the key, is just, I am who I am. Don't try to be someone else.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I think number one is it's really hard out there. So give yourself some compassion, right? You're not broken. We're not broken. We're very resilient people. So hang in there and take care of yourself. My second takeaway is if you want to leave, it's okay. There are so many things that you can do. And I think my third takeaway is, but you don't have to leave, right? Figure out what charges up your battery and make sure you do it. Like, you are much more than just a physician.
Deborah, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
Thank you, Kevin. I really appreciate you having me on today.